Health Foundation's Community Engagement Initiative, RFP. I'm Sean Brown, Program Officer with the initiative, and joining me today are my colleagues, Ashley Brown, who is the Project Manager for the Center for Global Policy Solutions, and Elisa Buller, who's the Grants Officer here at the Foundation. Just a little bit of background regarding the initiative and why we created it. Kansas ranks 27th in the nation according to the United Health Foundation's ranking of states. And Kansas has varied from 8th, its healthiest rank, to 27th, its poorest, where we are now. And we recognize that underlying factors such as poverty, low educational attainment, and unemployment may limit opportunities to lead a healthy life. We also recognize that there are many significant health disparities related to social and economic factors, and that these social determinants have a tremendous impact on health, and that it's important to address these underlying root causes in order to improve community health. During the past 2 weeks, we've held 5 RFP informational meetings across the state, and this webinar will recap what was covered during those meetings. And we'll also be posting the questions and answers from each meeting on our website, so please review those as they contain important information. The purpose of our webinar today is to describe the Community Engagement Initiative. We'll walk you through the proposal process, the online application submission, and we'll answer any questions. And those will be posted on our website. The purpose of the RFP itself is to support 5 communities that are experiencing elevated concentrations of health risk and realizing their vision of a healthier community. And we recognize that effective community engagement in which community members make decisions and take action is essential for achieving public health outcomes. So we see this initiative as being different from some other efforts in the fact that people are really pushing up from the bottom in this grassroots effort. In some cases, you might have a government leader or business leaders that make decisions without involving the residents. For example, I'm reminded of a situation where there was a gas station company that had decided to build a truck stop on the main thoroughfare in the community. And when the residents found out, they were really upset and opposed to the plan because they felt it would bring crime to the area and would really negatively impact their quality of life. So the community residents and homeowners associations in the area, they pulled together, started a petition to let the gas station know that if they built that truck stop there, they would boycott and not buy gas. And not only would they not buy it from the gas station in their neighborhood, but they would not buy it from that gas station anywhere. And in doing this, they gained the support of a local car dealer and the city councilman. And the long story short is that the gas station decided that it would not build a truck stop, and instead they built a regular gas station there with a convenience store. And this decision was a win-win for the community and the company because 2 years later, there were 2 upscale apartments that were built on that street. There was a new grocery store that was built across from the gas station. And had that truck stop been there, it's unlikely that the area would have been able to attract those new businesses. So in this case, you know, the residents were reacting to the situation. But with the Community Engagement Initiative, it's really designed so that the community residents themselves are taking a proactive lead with the support of the community-based organization to determine how they're going to bring together the various sectors that will be necessary to improve where they live, work, and play. And so they will be advocating for those decision makers and serving as change agents for what they want to see happen in their neighborhood. There are 41 eligible counties, and who would participate was determined through reviewing a number of socioeconomic factors. We looked at poverty, educational attainment, unemployment, health insurance coverage, and the county health rankings. And as you can see, we have a diverse number of counties and a pretty good representation across the state, with a large segment being in the southeast being covered. And we made this recommendation to our board and received approval to include these counties. I'd also like to highlight that the Community Engagement Initiative is place-based. So the community is a geographic area with defined boundaries. So within the counties, the initiatives may include neighborhoods, towns, cities, or possibly an entire county if it's a small county. So it's really designed to impact at the local level. The Community Engagement Initiative will fund and support a community organization or coalition to coordinate a resident-created and resident-led process. And we really see this as an opportunity for residents to determine the issues that are important for them to address. And so the grant will provide training and support for advocacy with organizational decision makers. So we're going to look at, how do you influence those local government entities or business decision makers? How do you bring them to the table? Also, the grant will provide training and support for communications, looking at, putting together a communications plan as you share your story of what's happening in your community. There will also be training and support for cross-sector engagement in bringing various partners to the table, say from banking or business owners, or really every sector in between. So who needs to be at the table and how do you get them there? And then fundraising. In addition to the grant funds, grantees will have an additional $100,000 available in matching funds. And it's anticipated that after you develop your community action plan, that you may seek support from other foundations, business partners, or supporters from various sectors to help implement projects and programs identified in the community action plan. And actually we'll be covering that a little bit later in terms of matching dollars. So, we recognize it's important to have those early wins, something tangible that people can see. So these matching funds will help, and there'll be training and support to assist you with that. But that's not something that you have to worry about up front, but, a little bit further down the line once the action plan is developed. So there are three overarching objectives. And so by addressing community-identified objectives, one or more of the following outcomes are anticipated. And that's increased community access to and consumption of affordable, healthy foods, improved community design to support active living, and improved student outcomes in community schools. And we recognize that the role that education plays and its impact on health outcomes, particularly in light of potential funding to schools being reduced. So education is one of those issues that a community may face in terms of, how will children be provided quality education, and what policy efforts do they need to undertake to ensure that all children are ready to succeed academically. We also recognize that social determinants have a significant impact on health. So in looking at the built environment, for example, issues such as neighborhood safety or other issues at first glance that may not appear to have a direct focus on health may need to be addressed before significant progress can be made towards comprehensive community health. So I want to stress that, although there are these overarching objectives, that communities have a broader leeway in determining what the issues are that are pertinent to their community and how they're going to address those. So to help communities reach their goals, one of the methods that will be used will be the Plan, Do, Check, Act cycle. And each community will implement the cycle as it develops its community action plan and pilots one programmatic initiative. And so we essentially call the first phase the demonstration phase because it's anticipated that communities won't just remain in diagnosis and develop a plan, but that during this time they'll actually seek to make progress on the issues identified by the community. So we don't, want the paralysis of analysis syndrome to set in, so to speak, during this time, but for you to really try to make as much progress as you can. So during this time, during the planning stage, there'll be a community visioning session. There'll also be community surveys, and then you'll draft the community action plan. And then during the do phase, there'll be pilot testing of the priority area from the draft community action plan. And then you'll be checking. There'll be the community visioning sessions again to assess the pilot and reevaluate the community action plan. And then lastly, there'll be full implementation of the community action plan. But we, anticipate that this cycle will be repeated throughout both the demonstration phase as well as the implementation phase. And so at this point, I'd like to turn it over to Ashley, who will go over more detail about some critical components of the demonstration phase.
Good afternoon. Again, my name is Ashley Brown. I'm the project manager for the Community Engagement Initiative. The Community Engagement Initiative is broken up into two phases, the demonstration phase and the implementation phase, as Sean said. The demonstration phase is part planning, part doing. The first step would be to hire your community liaison. This is the point person for your community organization. And then you would host your visioning sessions with community residents. This is where you discuss the vision for a healthier community, you identify the priorities that you would like your community to work on, and then you would create your community action plan. You would then develop coalitions. Who are the key stakeholders on the ground who can help realize your vision? Who should be at the table? And then you would identify one priority area from your community action plan to test. So this could be something like you realize that school facilities aren't open to the community after hours, and this could be an opportunity for community members to get exercise. So you decide to work with schools in the area to make those facilities available so that community members could be more physically active. That's an example of one priority area. You would then launch the pilot project as part of the do part of the Plan, Do, Check, Act. And then you would host your second community visioning session to assess the pilot and reevaluate your community action plan. And then for your implementation phase, this is the ACT phase of the Plan, Do, Check, Act cycle. You would implement program initiatives and or policy strategies outlined in your community action plan. And finally, you will secure additional funding sources. So throughout this initiative, you should be working with key partners to sustain this initiative past the 35-month period. Next slide, please. So the scope of work, staffing. Each community organization will designate a community liaison who will serve as the primary point of contact. The liaison will do the following. They will serve on the Community Engagement Initiative's Health Coalition. So again, each grantee, 5 of them, will have a community liaison, and these liaisons will form a coalition. They will conduct comprehensive community outreach. Again, who are the key stakeholders in the area and who should be at the table when you're engaging community residents. They would provide feedback on resources needed for technical assistance. The grantee would push up any technical assistance needs to me or the state director. That could be technical assistance with advocacy or a communications plan. And finally, the community liaison would collect data for the evaluation and the community health scorecard. I'll talk a little bit more about this on the next slide. Next slide, please. So the community engagement management structure. Again, I am the project manager, and then each grantee has a community liaison, and they report to the state director. And then the state director is kind of the liaison between me, the project manager, and the community liaisons, and they would push up any technical assistance needs to me. Again, we're the experts on communications and advocacy and cross-sector relationships, so we would help those community organizations with any needs they may have. Next slide, please. Again, training and technical assistance. Grantees will participate in training opportunities and identify technical assistance needs. These could be communications needs or advocacy needs, as well as evaluation training. Reporting, grantees will meet regularly with the state director and submit monthly progress reports. So we will be having bi-monthly calls with the liaisons and the state director. And the evaluation, the grantees will participate in a pre-post survey. The survey will be administered at the first charrette, at the second charrette, and finally at the end of the grant period. And then they will work on the community health scorecard. So the scorecard helps measure the progress toward your community action plan. And if you were chosen as a grantee, you would learn more about how to complete your scorecard. Next slide, please. Who may apply? Eligible applicants must be classified as tax exempt under Section 501c3 of the Internal Revenue Code and can include civic associations, faith-based organizations, charities, educational institutions, and local community foundations. Again, we're looking for organizations who are really rooted in the community and work regularly with community residents. Applicants may be a singular organization, a partnership of anchor organizations, i.e. educational institutions, community foundations, or an organization representing a larger community coalition. So if you think your organization doesn't have the capacity to apply for this opportunity, think about partnering with another organization to build your capacity and submit a stronger application. Next slide, please. KHF anticipates receiving proposals from nonprofit organizations who are well positioned to implement activities related to the RFP and objectives and have demonstrated the following: experience managing resident-led health initiatives, competence in community organizing, coalition building, and advocacy, experience related to healthy eating and active living is encouraged, and experience driving cross-sector collaboration. These aren't requirements, but we would prefer that the applicant have these attributes. And again, don't be discouraged if your community organization doesn't have all of these things. Think about the partners and the assets you have already in your organization, and be sure to highlight those in your proposal. Next slide, please. Available funding. Again, this award is a $250,000 maximum award amount. Strong consideration is given to cost effectiveness of proposals. This grant is for approximately 3 years or 35-month grant period. Funding will be distributed by the project phase. There will be $100,000 for the demonstration phase by June 1st, 2015. There will be $150,000 distributed for the implementation phase by October 1st, 2016. An additional $100,000 per community in match funding is also available. This is a dollar-for-dollar match. This is not in-kind match. This is a cash match. Next slide, please. Your letter of intent is due March 12, 2015. If you don't submit a letter of intent by the state, your proposal will not be reviewed. Your letter of intent must include name and address of the applicant organization, primary contact name, title, and contact information, description of applicant organization, organization mission, experience with community engagement, and a reason for interest in this initiative. You would explain that in 2 paragraphs or less. In the RFP, it says that your LOI needs to be signed by the highest ranking official in your organization. This is not true. Your LOI does not need to be signed by the highest ranking official in your organization. And if you think you anticipate that you will need technical assistance for your proposal, if you think you'll need help with it, please list that in the letter of intent, and we'll be sure to contact you, and we'll provide any help you may need for your proposal. Next slide, please. Conflicts of interest. To avoid any real or perceived conflicts of interest, KHF reserves the right to not fund organizations that have contracts with or receive funding from, including grants or sponsorships from tobacco companies or soft drink manufacturers. Applicants must include a signed statement describing any financial relationship with tobacco companies or soft drink manufacturers. Next slide, please. Important grant exclusions. Lobbying. A wide range of non-lobbying advocacy activities may be supported: real estate acquisitions, direct mental health and medical services. Next slide, please. So this is your timeline. Again, the letter of intent is due March 12th, 2015 by 5 p.m. Your proposals are due April 27th by 5 p.m. The demonstration phase begins June 1st and ends September 30th, 2016. The implementation phase begins October 1st, 2016 through April 30th, 2018. The grant award is announced May 18th, 2015, and your annual grant progress reports and financial reports are due July 1st of every year, 2016 through the end of the grant period, which is April 30th, 2018. Next slide, please. Your proposal requirements. This is the scoring sheet for your proposal. Notice that capacity and experience and community definition, demonstration of need, and readiness for action are weighted the heaviest. This is what we're going to be concentrating on when we're reviewing proposals. So it's important that you can demonstrate your need and readiness for action, as well as your capacity. Next slide, please. Your online letter of intent and proposal process. All of this information is available on the kansashealth.org website. And if you have any questions, feel free to contact me or Sean. Next slide, please. This webinar recording will be available on our website, as well as the frequently asked questions from the RFP information sessions that we've had in different communities. That would be available on kansashealth.org/community engagement RFP. Next slide, please. Oh, that's it. Again, if you have any questions or any concerns, feel free to contact Sean or I, and the RFP questions will be available on our website, and and any information regarding the letter of intent and this webinar recording will also be available on our website. We thank you for your interest in this opportunity, and we hope that we look forward to seeing your proposal. Thank you.
And this is Elisa, and I'm going to now go over the online letter of intent and proposal submission process. And with that, I'm going to also go over our website. So I'm going to just pull up our website for you. And on that second to last slide, it mentioned our website, which is kansashealth.org. So as you can see, this is the homepage of our website. To get to the Community Engagement Initiative RFP page, you can see there's a quick links box in blue on the right side of the page. So I'm just going to click on that Community Engagement Initiative RFP link. And once I click on that link, you'll see a brief description of the initiative. And then you can also, underneath that, find the link to the RFP itself. So if you need that document, you can access it on this page. Nextly, we provide the dates for the letter of intent submission due date, as well as the proposal due date, and just some other documents that you'll need to complete. So we have 3 different documents under this section that will need to be completed and uploaded to your online proposal. The next document that we provide is our grant agreement template. So please make sure that you've read over this template. It describes the terms that would be listed in your grant agreement if you do receive a grant from the Kansas Health Foundation. And then once you've read and are in agreement with those terms, you would fill out the Acknowledgement of Agreement Review form, which is accessible above. Sign that and upload it to your proposal. And I'll get to that here shortly once I go over the online proposal process. And then at the very bottom of the page, that's where you're going to find the link to actually complete the online letter of intent. Again, that online letter of intent must be submitted before you can submit a proposal. If you do not submit that letter of intent, you'll not be eligible to complete the online proposal process. So what I'm going to do is click on that link for the online letter of intent. And again, these letters of intent are due on Thursday, March 12th. So the first page that you'll see is our sign-in page to access our online proposal module. If you've never used our system before, there's some information on how to create an account. Simply click on the new applicant link underneath the email toolbox. Once you click on that new applicant, you'll sign up with your email address and create a password. For now, I've already got an account, so what I'm going to do is just enter my email address and then enter my password. Once I've done that, it's going to take me to the online letter of intent. Again, these must be submitted by 5 p.m. Once that 5 p.m. deadline has hit, the online letter of intent will be taken offline and you'll no longer be able to submit it. So again, what you'll need to fill out is just your organization's name, tax ID, address, and phone number. We'll also have you complete who's the primary contact for the proposal. And we'll ask also for their email address. So please make sure that you've entered that email address correctly. If we have questions and want to contact you, we need to make sure we can contact you. So please make sure you've entered that email address correctly. And then finally, we have you complete 2 different questions. The first question is providing a description of your applicant organization, including your organization's mission, experience with community engagement and key partners, and then also the reason for your interest in this initiative. So once you've completed that letter of intent, you'll hit that review and submit button. And once you've submitted it to the Kansas Health Foundation, you'll get an automated email from us letting you know that we've received that letter of intent. And within that email, you'll also receive a link to complete the online proposal process. Again, that online proposal is going to be due then on April 27th. So once you hit that submit button, then you would get the link to complete the online proposal. So I've opened up what that proposal will look like. So first of all, you have your sign-in page where you log in with your account, which is your email address and password. The first page you'll see will, again, make sure to show you the deadline for the due date. So again, the first information you're going to see is what you have entered on that letter of intent. That information is pre-populated onto your proposal. So it's going to list your organization's name and all of your contact information. The next thing that we'll need you to fill out is the primary contact for the organization. So that's going to be the person that would be eligible to sign off on a grant agreement if your organization is awarded a grant. The next question, again, is pre-populated from who is the primary contact for the proposal. So that's that person that's probably going to be the main person involved with the grant or the project director. And then we'll ask you to give a title for your project and then the start and end date, which those dates, again, are in the RFP. The next page is going to ask you to upload the proposal narrative. So the instructions to complete the proposal narrative, again, is in the RFP. Please make sure that you're paying attention to the page limits listed in the RFP and filling that out on a Word document. And once you've completed your proposal narrative, you'll just need to upload it to this proposal. So to do that, you would click on the Choose File button. You would search for that proposal narrative that you've completed and saved on your computer. So here's an example of a document that I've completed. And then I'll simply click the Upload button. Once I've selected that Upload button, it'll show me that my document has been uploaded. If I want to take it down and revise it, I can just select that Remove button. So the next page is going to be the budget and justification page. The first field that we need you to complete is the amount that you're requesting for your grant. So that would be the total amount that you're requesting for the grant for both the demonstration and implementation phase. So that would be up to $250,000. The next portion is going to be completing the budget and justification template. That is going to be one of the templates that is available on our website. So you'll just need to open up that document, fill out the budget and justification template, and again, just upload it to your proposal, which is going to be the exact same way that we just did with the proposal narrative. Once I've done that, I'll go to the next page. And this next page is going to be the financial relationship statement page. Again, this is a template that's available on our website. So simply sign off on that document, and you'll need to upload this attachment. The next page is going to be that acknowledgement of agreement review page. So again, simply look over our grant agreement template, make sure you've read the terms and are willing to accept the terms of the agreement if you were to receive a grant from us. And if you are willing and able to accept that agreement, you'll just need to sign off on that acknowledgement of agreement review template and simply upload it to this page. And then the last page of this proposal is going to ask you to upload a number of other attachments. So first we'll need you to upload letters of support or commitment, upload resumes, also upload 3 references, and then finally we'll ask you to upload 3 different financial documents. So we'll need you to upload your IRS Form 990, your most recent unaudited financial statement, and then your most recent audited financial. So the instructions to upload those attachments listed above are exactly the same as how we uploaded that proposal narrative. You'll simply scroll to the bottom of the page, and from this drop-down where it says title, you'll select the document that you're wanting to upload. So let's say I want to upload my IRS Form 990. I'll select that from the drop-down, and then I'll simply choose the file on my computer and select the Upload button. Once you've uploaded all of those documents, you'll select the Review and Submit button. And once you've done that, it's going to take you to one final page for you to review that full proposal one more time, and then you'll see a Submit button. Once you hit that Submit button, you'll get an automated email from us letting you know that we've received that proposal and that it will be in the review process. Again, announcements will be made by May 18th, so please make sure that you're looking for those announcements. Again, just want to take you back to the last slide. Again, there's going to be the question and answers that were received during the information sessions posted on our website. So please make sure to check our website and read those questions and answers that were received. Again, thank you for attending the webinar, and we look forward to receiving your proposals.